Good morning. I'm going to try and show you a routine for lower back pain this morning. And believe it or not, it's going to start with the feet. Okay, this is what a normal foot would look like. You see the arch in the foot. Okay, from the front it would look like that. From the side you would see an arch. However, I'm really flat-footed, so you see there is no arch. And when my foot caves in, you see the ankle bows medially or inwards. From the side, it looks kind of like that. That's severe pronation, or some people call it pronation distortion syndrome. What happens is when heel strike occurs, and then mid-stance, your foot caves in. Puts a lot of stress on the posterior tibialis tendon. And this can lead to distortion or dysfunction of the kinetic chain. Okay, so we're going to start with the foot. Okay, you can see I have a towel on the ground. And now I'm going to perform what they call windshield wipers to try and drag the towel and strengthen my arch. Now I'm on carpet, so it's pretty hard to do, but it still works the muscle. Okay, so I'll do 3 sets. I drag it and put the towel again. Then with my toes, try and grab it and drag this towel towards the middle. Okay? Now sometimes you can fold it or put a crease in it so there's more to grab. Okay? If you're on a mat floor, it's a lot easier to do, and you can stick a weight on the edge of it. Remember, this isn't for hypertrophy. This is just to get the muscle to fire. So you don't need a heavy weight, 2-pound weight, 3-pound weight. See, it's very difficult on this, and the towel's it's real soft, so it's hard for me to grab with my foot. So I'm going to try and grab it with my toes. But the idea is to fire this muscle. Okay? So we go to the other side. Get the left foot going. This is to wake up the muscles. Okay? And whenever you can, if it's possible, I know it's not too possible in most commercial facilities, I exercise with no shoes on to use my feet. This thing is driving me crazy. Easier said than done, huh? However, you got to be careful when you have no shoes on. If something drops on your client's foot, there's going to be a problem because they have no protection at all. So you can see I'm just trying to activate the arch. Okay? That's important. The reason why we started with our feet, so you can see, is if I pronate or excessively pronate or flatten my feet, you can see my knee internally rotates and adducts a little bit. When that happens, it puts a length on your glute. Now, your gluteus maximus has a lot to do with lower back stabilization, so we don't want this pronation distortion syndrome, so that's why we're starting with the feet. We started by activating the arch. Now we're going to move on to lower back. I'd like to start with some dynamic movement for my back. I use a pretty light medicine ball. This is a 2.5K. So I like to stretch my lower back at the beginning, just a little bit. This is not static stretching. There is slight movement. I pause at the bottom. I'm stretching my lower back. Try and do that a few times. Now, you can also warm up on a treadmill or an elliptical or a bicycle. I usually ride in the morning on my bicycle first, so I'm pretty warmed up. But even if you didn't and you did this slowly, it's okay. And I can pick up the movement a little bit, trying to get my glutes going. And actually, for lower back, we're going to hit all the muscles that attach to the pelvis. Okay? I'm extending the ball slightly. Put a little more load on the lower back. Notice I control the balancing. Also, slow down, a change of direction. I have an arthritic left knee, so the change of direction is what kind of bothers it. So I go from a squat, go to a wood chop. Modify it at the beginning. I'll show it to you from the side. You can see I'm going to go into some extension. It doesn't bother me. If you had clients where the extension bothered you or bothered them, then you would modify it to go to here. Okay? It doesn't bother me. Real important to bend your knees while doing this. Remember, when your IT bend gets taut, it gives the gluteus maximus a secure place to attach to. Remember, your glute attaches to the thoracolumbar fascia at the ilium, top of the ilium, and the thoracolumbar fascia attaches to the spinous process of your spine, attaches to the ligamentum flavum, which is on the inside of your spine, attaches to the transverse abdominis. So that thoracolumbar fascia is a really integral part of lower back stability. Okay, well, that was the sagittal plane. Those were both sagittal plane movements. So we're going to go to lateral or frontal plane movement, lateral flexion. This is challenging. Lateral stabilizers of your pelvis. Now you can do this one-legged, really challenging. Remember, this is a warm-up. Okay, now we'll go to transverse plane, or twisting. And again, I have a bad knee, so I'm going to let my heel come off the ground a little bit, because I'm just doing this to warm up my spine and the rest of my body. Nice and slow. And you'll see, by doing it this way, you got a little internal rotation of the femur and external rotation as well. So warming up the hips, which is great. Okay. Now we go to a 45-degree P and F pattern. You notice I'll disengage this foot, and I don't look straight ahead because the spine is rotating one way. I want the cervical spine to rotate the same way. Now if I was a golfer, maybe I wouldn't do that, but I'm not a golfer. So I'm just trying to warm up.